This is Dr. Ryan Bell with Yada Yada. We're here to talk about nosebleeds in kids. Nosebleeds are a very common thing in kids. They can be very scary for parents depending on the timing and the amount of blood. A couple of things that we look at pretty closely when it comes to nosebleeds. First thing is, we want to make sure there's no other bleeding or bruising issues with your child. If your child also has issues with their gums bleeding when they're brushing their teeth, or blood in their stools when they're having a bowel movement, or if they're bruising really easily, or you're getting unusual spots on their skin, like little red dots that we call petechiae, any of those other factors make us worry more about nose bleeding. Generally, it's a very benign thing. The blood vessels on the surface of the nasal septum tend to get dried out really easy, especially certain times of year and in certain dry climates. A couple of things that we want to look at as far as causes for nosebleeds. The number one thing in a child is going to be the dry air. Nose picking can be a huge factor as well. Once you get a dry, cracked blood vessel on that nasal septum, your child's putting their finger up into their nose and clearing out some of those clots and some of those dry areas. It's really easy for that nose to start bleeding again. So you really try to discourage any nose picking. Things that you can do to help would be to put a humidifier in your child's bedroom, especially at night when they're asleep. We can try to do things to keep that internal surface of the nose moisturized. So a saline spray or saline gels. I even like to have my patients do a little bit of Vaseline on a Q-tip and just real gently kind of put it up into their nose and then kind of squish it around. Those types of things can help those blood vessels to heal and keep some moisture in the nose. When your child actively has a nosebleed, the best approach is to have them sit up straight, lean their head forward. You can put a little bit of pressure onto the nose, either kind of up at the bridge or down onto the soft part of the nose. Give it a good squeeze, try to decrease the blood flow to that area, and then to hold pressure, to hold Kleenex or some toilet paper, hold that nose. If you give it a good 5 to 10 minutes, you should get those nosebleeds to stop. If you release pressure at that point and it starts to rebleed, do it again, give it another 5 to 10 minutes. If you feel like, boy, that we just can't get this to slow down and we're not making progress, consider calling your doctor's office or do a visit. There are times where those nosebleeds happen often enough, are significant enough with the amount of bleeding and enough of a problem for a particular child that we'll end up referring them to see an ear, nose, and throat doctor to have the nose evaluated better and sometimes cauterized, where they actually go in and fry those blood vessels so that they're not going to continue to crack and open and bleed. But those are the factors that we think about as we see these kids with nosebleeds. It's very common, especially middle of the summer, middle of the winter, but contact your doctor's office if you have questions above and beyond that. Thank you. Have a good day.